My name's Liam Yates and I work in the Addictions and Inclusion Health part of the public health team at East Riding of Yorkshire Council. So in Addictions and Inclusion Health, my focus is more on the addiction side of that. On offer within our services, we've got an adult service, we've got a dedicated young people service called Impact, and we'd like that name to be recognisable for people, for young people and families, so they can recognise that Impact brand. We have services for families and friends of people who use substances, because substance use doesn't always just affect the individual who uses substances, but also the families and friends of that person as well. When we talk about substance use, we're talking about drugs and alcohol use, but one often forgotten part of that is things like prescription drugs. People may often be prescribed a certain substance, a medicine, a drug by their doctor, and in some unfortunate cases people can become addicted and dependent on those substances. What we do is we assess the needs of the population to work out what is going on out there and how we can help. So then that informs how we might design a service to help people, to offer support and treatment to address those needs that we've assessed in the first place. That ensures that those needs are being met, health outcomes are being improved for residents across the East Riding, and also that the money that is spent, the public purse, is protected and is being spent efficiently and correctly. We know that our services are working and performing as they should by using something called NDTMS, that's the National Drug Treatment Monitoring System. Now that's got a lot of data and information that shows us how the services in the East Riding are performing, are they achieving the things that they should be achieving, and one thing that it does show is that of the people in our treatment services, they show the most substantial progress in their treatment and recovery journey across the entire country. So it's the best in the country is within the East Riding. It's worth pointing out that we achieve this in the East Riding with a lower spend per head of the population. So that means we're attaining an excellent quality service with fantastic outcomes, but we are still spending less than many other areas in England on that service. And it shows the efficiency and the quality of our processes and also the providers that we work with. For every £1 that we spend on drug treatment, we save £4 elsewhere. That could be later down the line, it could be elsewhere in the system, for example in policing, secondary and emergency care, hospitals and social care as well. And similarly, for every £1 that we spend on alcohol treatment, we save £3 elsewhere and later down the line. So it shows how it's worth spending money on prevention, these preventative services, because it saves more than we spend further down the line and in other areas of the system.